A cell biologist from University College London, Jennifer Rohn, says it is impossible for any country to prevent the COVID-19 Delta variant from taking over without a wall of vaccination. Rohn discusses this more on Bloomberg TV. Let's listen in.
I think the problem is that this variant is really contagious, much more contagious than previous variants. It's very easy to get, and you can't really stop the spread of a variant unless you've got a wall of vaccination. And I'm afraid no country, even the UK, which has such a great record, has that wall that can prevent these variants from taking over. So what it is at the moment is a race between vaccination and the spread of the variants.
Jennifer, how concerned are you about some of the emerging markets actually not having enough vaccination? So here in Europe, we seem to be doing okay, the US as well. But if we don't vaccinate the whole world as fast as possible, could it lead to much worse variants to which the vaccinations actually don't work?
Absolutely. That's exactly, you've hit it right on the head. So as long as you don't have that wall of vaccination worldwide, there will be a breeding ground for new variants. So all the ones that the vaccine works against will get eliminated, but then they will be outcompeted by new variants, which are always coming up. And then these new variants threaten our security because they may be able to get through our vaccine strategies. So as long as the entire world is not safe, nobody is safe because borders are porous, people get through, variants spread. We've seen that over and over the past year. So until everyone is vaccinated, we can't sit back and say, oh, I'm okay, I've had 2 jabs. It doesn't work like that.
Do we still need to wear a mask when we're vaccinated? So the U.S., the way the U.S. is going about, how to deal with people that are double vaxxed compared to some European countries is very different.
Well, there's not a lot of data on whether vaccination prevents transmission. So we know in some cases that it does, but I think we don't have enough evidence. And I think it's a good bet if you've been doubly vaccinated and it's been, a month since your last vaccine, you're probably unlikely to spread virus as much, but it's not completely ruled out. So. And of course, most people aren't fully vaccinated. So I think masks may be with us for some time, although I do understand that the public's appetite for them is waning. Public Health England just had a great study that showed that Pfizer alone or Oxford alone was more than 90% effective at preventing hospitalization against the Delta variant. So even just the single type vaccines are working really, really well, much better than we had hoped. The mixing and matching, I think the data are still out.